My name is Holly Ann Boss. I'm an agency owner for insurance in Wagner, Oklahoma. I had the iFuse procedure in December. I started having back problems and pain after having 2 back surgeries. My pain affected my life by not allowing me to sit for a long period of time, going up and down stairs, being able to do laundry, housework, lifting things, cooking, cleaning, all of those things kind of came to an end. Treatments that I tried for my pain were physical therapy, and I had 2 sets of injections on both sides. Went to see Dr. Thambuswamy, and he said that it was not my back, that it had to do with the SI joint.
My name is Michael Thambuswamy. I'm a neurosurgeon at Oklahoma Spine and Brain Institute. I want to talk to you today about sacroiliac joint fusions. The sacroiliac joint is a joint that is located in the pelvis. There is a joint where the 2 parts of the pelvis meet together, the sacrum and the ilium, and this joint doesn't have a lot of motion. SI joint pain is typically caused by inflammation and arthritic changes of the sacroiliac joint. This can create a pain that is located usually not necessarily right in the middle, but slightly off to either the right or left, and can create some radiating pain that can go to the buttocks and to the posterior leg. SI joint pain is extremely common. A lot of times it's even misdiagnosed. There are studies that show 15 to 30% of patients that present with low back pain are actually experiencing pain from the sacroiliac joints. There are specific tests that we perform in clinic with the patient to help to determine, is this pain coming from the spine, is it coming from the sacroiliac joint, or is it coming from the hips? One of the key diagnostic elements for determining patients to have sacroiliac joint pain is a diagnostic injection or diagnostic block. This is usually done in our practice under fluoroscopy, where we place a combination of either just a local anesthetic or possibly a steroid and possibly a little bit of numbing medicine to help see if we can get longer term relief. With these injections, typically speaking, you should expect at least 75% pain relief if it is truly the SI joint that is the source of the pain. So if patients are truly diagnosed with sacroiliac joint pain, they have a few options. Typically, we start with the most conservative options, which may be a combination of possibly some physical therapy or chiropractic manipulation to see if we can get the patient's pain to resolve without the need for further treatments. We have an option for a fusion of the joint to help stabilize this joint so it does not move and create ongoing pain. I typically perform sacroiliac joint fusions from a lateral approach. I then make a 2 to 3 inch incision on the side of the affected hip. We then bring in intraoperative x-ray to take pictures of the hip from multiple views. That helps me guide wires across the joint. Over the wire, I'm able to pass a small drill to drill a small path for our implants. I then typically use SI bone iFuse systems. The iFuse Torque, which is a 3D printed threaded titanium, which is also porous, which allows bone to grow within the implant and across the SI joint to make it nice and solid and fused. I typically use 3 implants to get a good biomechanical advantage to help with eliminating rotational and shear forces. This procedure takes me approximately an hour.
What I remember about my recovery is I did have a walker for I think about 2 days. After that, it was just taking it slow, but the recovery process is amazing. I mean, it's not anything what I was expecting it to be. It was a lot better.
I use the SI bone iFuse implants because I believe that the 3D printed porous titanium is an advantage. I believe that the design of the products are advantageous. The lateral approach is advantageous.
And now that I've had the iFuse procedure, I'm able to get up, not worry about if I can do something or not. I can just go do it.
I started performing sacroiliac joint fusions because of the need of my patients. I was seeing patients come in over and over again with sacroiliac joint pain that conservative measures were not providing adequate results. For a lot of patients, they will not need an ultimate fusion. But for those that do, we were left without a good option for treatment. So when I started learning how to do these SI joint fusions, I now had another tool in my tool belt to help my patients. If patients are having ongoing back or sacroiliac joint pain, I would highly encourage them to seek out professional guidance. If it comes down to it, we're happy to help with surgical options. Please come see us, Oklahoma Spine and Brain Institute, and we're always around if you need us.